So hello everybody and welcome back to my YouTube channel, and today's topic is going to be experimental screening models for a number of diseases. So in pharmacology and toxicology, whenever we talk about screening, so अगर आपको कोई भी एक disease का mechanism find करना है, or if you want to determine the efficacy or the toxicity of any particular drug, there are a number of screening methods. They can be either in vivo, in vitro, ex vivo, or in silico, depending upon the nature of the study and depending upon the level or the stage of the study. So today we will be discussing about a number of diseases like arrhythmia, lipidemia, ulcer, cancer, and different models of neurodegenerative disease like Alzheimer's, Parkinson, schizophrenia, epilepsy. So firstly, there are a number of techniques that are available for checking out and screening the drugs. So first is a humanized model. So we have humanized rats, humanized guinea pigs, humanized mice. So these are particular agents that are specifically induced with a human gene. So they possess certain peculiarities and characteristics that are similar, and they show similar genetic expression. Next up, we have organ on a chip. So organ on a chip is basically an organoid. An organoid is an agent. It mimics the in vivo environment. So it is a chip whereby there is different parameters that are controlled, like the pH, vascularity, blood flow, right? So all those things are covered. If you're working on some model that is for GI tract, so even the GI model, so for that motility is controlled. Next up, we have transgenic models. So your transgenic models basically involve it is similar to humanized only, but the genes are either by there is knock-in knockout models. So there is some transgene that is specific induced, or some gene that is removed, right? So like there are various techniques for, like there are Sendai virus, lentil virus mediated. Then there is sperm cell mediated, direct cell inoculation and injection in the amniotic cavity. Next up, we have cell lines and cell culture. So cell line is basically obtained from the primary cell culture itself, and cell cultures can be primary cell culture, which has a finite lifespan and is heterogeneous, while the secondary cell culture is a infinite lifespan. Like you can have multiple passages, and it has a good lifespan, right? So there are two other types as well, like suspension and adherent. So suspension mein the anchorage is independent, like you have floating cells, but in adherent type of cell culture, you have cells that are adhered to a particular space, like to a particular matrix. So there are various examples like lymphoblast, fibroblast. These are all cells, epithelial cells, endothelial cells, that belong to this category. Cell lines are basically, there are various cell lines that are available, like the CACO2 cell lines, Vera2A cell lines. So these are all cell lines that are useful in estimating colorectal cancer, adenocarcinoma. Basically, cell lines are widely used and extensively used in the studies of particular disease, and mostly in oncology. So we have a number of cell lines: CHOs, Chinese hamster ovary; HEK, human embryonic kidney, right? MDCK, Marvin Derby canine kidney cell lines, right? So there are a lot of cell lines that are available. Now let's move ahead to the animal models for epilepsy. Epilepsy, firstly, is a continuous firing of neurons. So if you are designing a model, there should be a particular chemical agent or a specific electrical agent. So there can be chemical mediated epilepsy, or there can be electrical shock mediated epilepsy. So in the chemical mediated, we have various chemicals like pentylene tetrazole, PTZ, strychnine, picrotoxin, isoniazid, and bicuculin. These are most commonly used, and currently the amygdala kindle rat model. This is a widely used model for inducing epilepsy. Next, we also have a kinase model. So there are various excitatory receptors in our body. So epilepsy is either due to inhibitory receptor GABA ka disbalance, or due to excitatory neurotransmitter NMDA, N-methyl D-aspartate, which has a different subtypes of receptors like AMPA, kinase receptor, right? So these are models. Besides this, you have electrical model, which is electroshock in mice. So electroconvulsometer, there is a ECM mediated epilepsy. There are different kinds of epilepsy: tonic-clonic, grand mal, petit mal, absent seizures, febrile seizures. Like, so diazepam is a drug of choice for febrile seizures. So for these different types of epilepsy, we can have different models depending upon the extent and the mechanism. So the rate of inducing of neurons, right? So the rate of inhibiting or GABA, or promoting, inducing your particular NMDA receptor. So all these factors are to be considered while we are preparing for animal models for epilepsy. Next up, we have ulcer. So ulcer, why does ulcer happen? Besides Helicobacter pylori, there are a lot of aggressive factors. So हमारी body में balance होता है between aggressive and defensive factors. So defensive factors or protective factors are basically mucus, prostaglandins, bicarbonates, and your mucosal blood flow. While the aggressive factors are spicy food, stress, smoking, alcoholism, NSAIDs, pepsin, these are all your aggressive factors. If their levels or if their consumption is increased, there are high chances of ulcerative colitis or even various diseases that are peptic ulcer, duodenal ulcer, esophageal ulcer, right? So for ulcer, we have various models, like we have shy rat model, ligation model, we have BET test, breath erythromycin test, we have C13 octanoic test, we have other models for constriction that bring about constriction of ulcers, right? So these are 7 factors upon which you can design your model. So suppose if you're thinking that you want to design a particular model, so what all parameters and what all fields you can think into? You can either design some biological model with the help of some virus, fungi, bacteria, yeast, protozoa. Electrical model, like in epilepsy, we have electroconvulsometer, so you can design some incubatory model, some any model that can bring about stimulatory or inhibitory effect. Vibrational, so there are a lot of vibrational models as well, like we have ultrasonic distress cell, we have a lot of acoustic models as well associated with it. So whenever there are vibrations, so it can help in detecting behavioral parameters. Then we have mechanical models, so we have a lot of few allodynia and hyperalgesia type of equipments. We have few filamentous substances or any substance that will cause a sensation of nociception, a sensation of pain, or a sensation of sensitivity, right? Chemical agents, we can look out for a number of agents that are available in the market. Somehow the other would have some side effects, right? Like bleomycin, so it can be used in lung toxicity because it causes pulmonary fibrosis. We have doxorubicin, it can be used in cardiotoxicity. So these are all agents that are chemical agents. Next up, we have physical agents. So these physical agents basically either it can be any physical means, or it can be any chamber, any maze, or anything, any apparatus, any equipment, any device that will fall under this category. Now we have different kinds of arrhythmia, and we have experimental models for different kinds of arrhythmia as well, right? So we have Wolff Parkinson White syndrome, we have atrial flutter, we have atrial fibrillation. These are all different kinds of arrhythmia that are being caused. Now these arrhythmia has different kinds of model as well, like you have PRKAG model for Wolff Parkinson White syndrome especially. So it is a gene. PRK gene is a protein kinase AMP activated gene. So this gene is basically mutated. Atrial flutter mein we have canine occlusion model. We have aconitin induced model. So aconite is widely used, right? Let me know in the comment section, where do we obtain aconite form, and what is Wolfsbane a synonym of aconite? Then we have acetylcholine induced flutter, right? Then fibrillation is basically by Langendorf. It is a retrograde technique whereby perfusion of heart, whereby there is retrograde perfusion. Next up, we have PECAP 27 model. So this PECAP model is also giving a lot of importance because nowadays for studying any particular like CGRP level specifically, right? So calcitonin gene related protein. So it is widely used in a migraine. But besides that, PECAP is also used in atrial fibrillation. It is pituitary adenylate cyclase activating peptide. Pituitary adenylate cyclase activating peptide, right? Ventricular fibrillation, we have canine kidneys, two-stage ligation, we have exercise induced. So treadmill, there are specific treadmills for rats, mice, you would have seen, like in humans also we have treadmills. Then we have electrical threshold induced. Speaking about drug abuse, so drug abuse, if you want to check a particular drug's dependency, habituation, addiction, tolerance, something like that. So there are various reward tests. What do we do? So in a cage, we have two inputs. In one input, there is a drug of abuse, and in the other, there is water. So your rat or mice will go to a particular lever, and whichever, suppose if it goes to drug, now tomorrow also it goes to drug. There are high chances that that drug is of dependency. So this is like also there is food reward test. So if you want to check any food, you can mix something in the food and check whether if the liquid is not if the animal is not consuming liquid, right? So there are various elicitation approaches like check the further you can check the neurotransmitter level or the nerve growth factors like BDNF, GDNF, NGF and all to check whether there is any effect or not. Or you can check the neurotransmitter levels like dopamine, acetylcholine, serotonin and all. Now, in vivo methods for arrhythmia include exercise induced, as I already mentioned, mechanical induced, electrical induced, and chemical induced. So, aconitin is widely used chemical, right? Electrical fibrillators we have for causing atrial fibrillation or flutter. Mechanical, again, exercise induced is a type similar to mechanical only. So, chemical induced arrhythmia mein besides aconitin, we also have digoxin for guinea pigs, strophanthin or uaben. Uaben is widely used in heart failure models as well. So, strophanthin model in dogs. And for cardiovascular diseases, dogs are very preferred as a higher animal. And then we have adrenaline induced. Then we have coronary artery occlusion or reperfusion technique, right? So there is ventricular remodeling, cardiac remodeling. So you check that particular thing. Then these are the different parameters like LVDP, LVSP, MAP, blood pressure, all those things you check, systolic, diastolic pressure, contractility, heart rate, ECG. है ना? So besides this, you can also do the D-dimer test that was widely used test and the CRP test, C-reactive protein. So these tests were widely used during the COVID, right, for the inflammatory purposes. Then you can check the nerve blood flow using laser Doppler. So laser Doppler is another very important that is based upon light reflexes. So laser Doppler is another technique that you can use. Now, heart has so many different types of biomarkers, right? From troponin, LDH, that are non-specific biomarkers, right? Selected dehydrogenase. We have troponin I, troponin C. Then we have FAP, like in hypertrophy, we have beta MHC, beta myosin heavy chain. है ना? We have a lot of other hypertrophic genes, creatine kinase, CKMB. Then we have MMP, matrix metalloproteases 9, C-reactive protein. Then we have brain natriuretic peptide, atrial natriuretic peptide, myelin peroxidase, MPO. Then there are microRNA techniques, silencing RNA, siRNA techniques, right? So these are all in biomarkers of the heart. Moving ahead, again, this is the same biomarkers and by which technique you can detect those. Mostly immunoprecipitation techniques and immunosorbent techniques, IHC, immunohistochemistry is applied. So we have enzyme-linked immunosorbent assay, ELISA. We have albumin coating binding assay by colorimetric estimation. We have chemiluminescence assay, right? So matrix metalloproteases, myoglobulin, CKMB, troponin. Then we have FAP, which is fatty acid binding protein. So these all techniques can be checked. Now Alzheimer's. Alzheimer's is basically a technique whereby you have lot of dementia. So there are a lot of dementia models that are available for Alzheimer's. These include thiamine deficiency, high fat, brain injury either by stereotoxy. So stereotoxy is a very important technique whereby you specifically damage the hippocampus neurons. Then you apply dental cement and all. Denervations, hypoxia, obviously oxygen, if oxygen is less, there are very high chances of loss in cognition. Then we have certain drugs that causes Alzheimer's, like there is scopolamine induced, you can check cognitive testing. Scopolamine is more widely used agent. Then we have spontaneous Alzheimeric rats, spontaneous hypertensive rats as well. So there are SHR, there is SAR, spontaneous Alzheimer rats and all that are available. Depression. So depression may you have lot of techniques in general like maternal separation. So suppose if there is a pup, if it is separated from the mother, there will be depression. Food deprival. If you deprive it of food and water. Sleep deprival. If you deprive it from sleep. Stranger model. If you keep in one only cage or in one compartment, similar, it is very close proximity. Rats and mice, it can cause depression, right? So there are these are basic models for depression. Talking about the stroke, so stroke may we have BCAO, bilateral common carotid MCAO and BCAO, middle cerebral artery occlusion and bilateral common carotid artery occlusion. So these are different techniques. Then we have microballoon inflation model. This is also a widely used model. Then we have endothelin B. So endothelin B is widely involved in the stroke pathophysiology, and there's a lot of importance. Embolus induced model. So embolus and thrombus, there are two terminologies. One floats and one stays at the position. Let me know in the comment section how many of you all know about this. So there is global cerebral ischemia, GCA, and focal cerebral ischemia, right? So depending upon the type of ischemia, we have different models, BCAO, MCO. Collagenase is also widely used as one of the models. So for this, we have corners test, sensory motor asymmetry test, foot fault motor function test, limb coordination test. Then we have adhesive removal motor dysfunction test. These are different types of tests that are available. Now the in vitro models, depression scale, we have inhibition of dopamine in rats striatal synaptosomes. So you inhibit the serotonin uptake. So in depression, there are two neurotransmitters widely involved, norepinephrine and serotonin. So you either act on these any of the receptors. Then we have adenylate cyclase, cyclic AMP model. Like then we have beta receptor stimulation, that is norepinephrine. MAO is also widely involved because we have MAO-A inhibitors, moclobamide and chlorgyline, that are used as therapeutic agents, right? Then we have NMDA receptor antagonism, serotonin binding affinity. So we have receptor binding assays as well that are available. So these assays can be used. Then we have a learned helplessness model. So the learned helplessness model is widely used assay or widely used technique. So here you can see it is like a maze. So there are steel rods and a shock is generated, foot shock. So it is used to check a variety of antidepressant activities. So here you can see there more details are given. You can just read through this details for more understanding and more detailed information. Next up, we have chronic mild stress model, right? So chronic mild stress model is again very widely used model. So here you can see the how they have like how they have taken different day wise and different parameters, different factors. So cage, they have taken one factor as cage tilting, one factor, so position of the cage, noise, water bottle, lightings. If there is lighting also, if the lighting is bad, there will be somewhat disturbance. Then there is water deprival, then there is paired housing test, all of them that I mentioned previously. So these are all kind of tests for chronic stress or acute stress depending upon the duration. So this can help in determining behavioral activities, sexual activity, aggression activities, increased mobility, right? So then there is sucrose Irwin's test, then there is sucrose preference test as well, SFT, sucrose preference test, SPT, right? So these are widely used tests for depression. Then we have genetic models. So genetic models can be either reverse genetics or forward genetics. So forward genetics is like an unbiased approach in which there are extreme number of mutations that are generated in a particular animal. And then there are breeded and screened and individual aberrant phenotypes are being checked upon, right? And in reverse genetics, it is not that preferred because there are genetic manipulations, genetic alterations. So there is a knockout model, knock-in model. So there is a lot of mRNA technique, and like mouse lines expressing Cre recombinase is a widely used uh, technique nowadays for like using a bacteriophage, right? Next, we have ontogenic mouse model. So ontogenic mouse model is again very widely used model. So here you can see how the genetic constructs is there. There's a promoter region, then there's a opsin. So opsin is a light sensitive protein present in our eyes. So there is retinol, there is opsin, right? And then there is injected into the virus. Then this virus with the help of a carrier mediated transport, right? So it is injected into the brain, and then it transfers the specific neurons from that carrier into the brain of the animal, and then it is being evaluated, like tested in chemiluminescence or radio level substances, and then neuronal activities checked. So whether it is causing neuronal activation, neuronal inhibition. Maternal separation, as I previously mentioned, there is a lot of maternal separation. So A is an example of natural variation, like where there's a good maternal care. One there is where there's poor maternal care. Then the B is a handling. So there is a quick handling of by the mother, and in some cases there is a late handling. Similarly, there is a maternal separation of deprival, and this is maternal stress. So it causes a paradigm of loss to feeling a feeling of loss to the mother, and this generates the depression. Sleep deprival model, here you can see the rat is sleep deprived. It's like it has a 12-hour light day cycle. I hope we all know 12-hour light, 12-hour nights. Like, so there are automated systems that are available. So these are one of the techniques. So 72 hours of sleep deprival is considered. 24 hours, 48 hours, 72 hours max, you know, not beyond that. And the levels of inflammatory mediators are checked, like interleukin 1 beta, interleukin 6, 7, 12, you know, all TNF alpha and all. Then there is very widely used model which is OBX, olfactory bulbectomy. So olfactory bulbectomy is resulting in a lot of endocrinal changes because olfactory region is responsible, right, for a lot conducting a lot of bizarre patterns on our body. So the behavioral changes can be easily detected by a olfactory bulbectomy damage. So here you can see in this image, this is a sham surgery operated model, and this is a model which has an olfactory bulbectomy. So it is removed the olfactory region. Right. Chemical models, maybe have corticosteroids, lot of, because HPA axis, hypothalamus pituitary axis, is responsible for a lot of neurotransmitter level release, right? Cortisol, which is also involved in chronopharmacology and circadian rhythms. Then we have reserpine induced, so reserpine also causes suicidal tendency. So it is also used as a model in depression. Then there is different tests like step up, step down, step through, staircase through, passive avoidance, active avoidance. So you can see step through down and step through, passive avoidance. Here you can see there is a time taken by this particular mice or a rat to step down, and your time taken by a particular rat to step from one compartment to another compartment, either from light to dark or from one environment to another environment. So the time taken to shift down or to step through, the name itself. Sometimes it's step up as well. So there is a mode like this, and the time taken to step up. So then there's a runway model. I have an image of a runway model as well. So mice or rats of either sex are taken, and then the runway model, there can be either foot shock or then can be any acoustic stimulus that is conducted. And 9 avoidances are usually checked in 10 trials. So here you can see this is very important model. This is a Rithings model, right? So Rithings model is used in pain or nociception detection. Rithings test. So you have tail flick analgesiometer. You have lot of different techniques, right? Um, tail flick cold immersion test, hot immersion tail test. So this is Rithings test. So one of the chemical is induced in the mucosal serosa of the rat, and then it shows Rithings like this. This is called Rithings. So then the things are being checked, and anti and the activity is checked for pain, analgesic activity. Then we have anti-inflammatory activity. So there are a lot of asthma conditions. So for that we have egg ova albumin, EOA, house dust mice, HDA, and HDM, LPS, lipopolysaccharides. Besides this, you also have certain ulcerogenic models, gastric mucosal damage model, granuloma pouch model, cotton pellet model, croton oil model, carrageenan-induced poedema. So carrageenan is a widely used irritant. Carrageenan-induced and you check the poedema, vascular permeability model, UV erythema model. So UV light causes erythema. Then we have adjuvant. So FCA, fluents complete adjuvant, fluents incomplete adjuvant, FIA, FCA. They are used in lot of arthritis conditions. Then we have granuloma pouch pleurisy test model, right? So there is a granule, you inject a drug and there is a pouch like created, like, so that pouch causes inflammation. So that pouch, like whenever there is a injection subcutaneously, there is a, you can experience a certain, you know, a bulb like condition in the particular area. Then we have in vitro models, may we have lot of PMN leukocyte aggregation, polymorphonucleoside, a chemotaxic model, receptor binding. PMN is polymorphonucleosides. TNF alpha antagonism. You know, these are all models for anti-inflammatory activity. So also I already mentioned few of the models previously. Shy rat ligation model, stress induced, NSAIDs, formalin induced model, ethanol induced model, histamine induced, because histamine is widely causing ulcers, right? That is why we get histamine antagonist. Then there is acetic acid induced model. NSAIDs, obviously with NSAIDs, aspirin and all, always an anti-ulcer drug or some antacids is prescribed because NSAIDs have a very high capability to cause ulcers. In vitro methods, maybe have gastrin binding assay, tioterin binding assay, hydrogen potassium ATP, because the hydrogen potassium ATPase pump is involved in lot of our activities in our stomach, right? Acid regulation. So like there is chloride shift, Hamburger's phenomena and all in our stomach that is occurring. So for that we have hydrogen potassium ATPase pump as well. Obesity. Obesity is something that is very common nowadays because of sedentary lifestyle. So one is by changing the diet, food induced. So there are a lot of food induced. You and either give it a lot of high fat, high cholesterol, high lipidemic, है ना, or certain high plasma, high rich containing drugs. Next is hypothalamic obesity. So hyperphagia is induced. So when hyperphagia means increase in the hunger. So when you increase the hunger, it will have more food. So that is another technique. So stereotaxic technique in which hypothalamus may there is a stereotaxically you operate and then they induce hyperphagia. Then there is alpha gold thioglucose induced obesity model. So these alpha glucose gold thioglucose is given usually intraperitoneal, and the injection of 30 milligram to 40 milligram per kg is taken, and then the food intake, body weight, and all of those things are being determined after 3 months. So you also check the SGPT, SGOT levels. You check the lipid profile, HDL, LDL, VLDL, chylomicrons, triglycerides level as well. Liver function test, KFT also sometimes you check, kidney function test, and creatinine levels, inulin and all, GFR, MSG, monosodium glutamate, Hashimoto. We all would have heard about this term. So they all are activators of our receptors, monosodium glutamate, right? So MSG is a chemical that is widely causing lot, and it is involved in increasing the hyperphagia. Again, it gives a taste sensation. So adiposity is increased by this particular model. Then we have assays for this model. So we have anorectic assay. Anorexia is basically food, bhook kam lagna, right? Less hunger. So anorectic models we have. Then we have apoe lipoprotein model. So apoe lipoprotein model is also used as a model in your hyperlipidemic conditions. Besides that, you also have PPAR alpha lipoprotein lipase model. PPAR alpha lipoprotein lipase. Then brown tissue, adipose tissue binding. So this is brown tissue is a major site for thermogenesis, right? So food intake is measured every day in this particular technique. So you can have a much more detailed idea about this technique ahead. So there is all GDP, mitochondrial distress, endoplasmic reticulum distress occurring. Then we have uncoupling protein and GLUT4 receptors. So there are different transporters and like SGLT transporters, GLUT transporters, GLP like GLP peptides, these are all transporters. So these are uncoupling membranes, and the transporters dissipate the proton gradient. So based on that proton gradient, we perform different expression techniques like Western blotting, Northern blotting, and all to determine the particular metabolism. Next is BMR, basal metabolic rate, can be determined of a particular animal and daily food intake, but mostly it is carried out in the albino mice or a Swiss mice, these kind of studies, or a C57 bulb, C57 mice. So this is it from particular obesity. Now moving on, we have sympathomimetics and sympatholytics drugs. Sympathomimetic and sympatholytic drugs are basically a lot of drugs that are given. So to check the cardiovascular analysis, we have alpha and beta adrenoreceptor in mouse, iris. So at sympathetic, parasympathetic receptors are present in abundance. You can check in the kidney, liver, lungs, intestine, motility. You can check iris may you can check mydriasis, meiosis. Kidney may you can check the urinary bladder, urethra ka contraction, relaxation. You can check you can check whatever you want because they are present everywhere, receptors. So you can check all the intrinsic activities of a particular body, like clonidine induced withdrawal symptoms and all you can check. So you have mentioned all the things that you can check: heart rate, cardiovascular, stroke volume, pulmonary vessels, asthma condition में bronchial muscle space, gastrointestinal, sphincters, spleen. So inflammatory may we also have one particular assay of inflammatory assay, anti-inflammatory assay. Besides that, we have a specific technique called plethysmometry. So plethysmometry is another very important widely used technique in asthma, or plethysmography is a widely used technique, like it measures the changes in the volume of a volume in the different parts of a body. So there can be different, it can be used to check the blood clots as well, or it can be used for penile plus pulse volume. It can be used to check the tidal volume, in respiratory conditions. So bradykinin induced, substance P induced models we have. right? And other models I've already mentioned previously. CNA में we have CNS में we have actophotometer, rotar rod, runway test, open field, Y maze, whole board, elevated plus maze, forced swim, swim despair, light and dark model, barbiturate inducing sleep model, motor coordination, tail suspension test. So this is a runway test model like Y shaped, Y maze. So also it can be converted into NART, novel arm recognition test, in which one arm you will be putting some specific special thing. So I will make a video on this specifically because this is going to be a long video, so can't explain much of things in detail. Then we have actophotometer, which is used to check the activity of due to CNS depressants or CNS stimulants, the motor activity and all. So actophotometer, this is the actophotometer, and you check the before treatment and after treatment, the percent increase, right? Open field, so the open field for rat has a different dimension, for mice has a different dimension. You check the exploratory activity. It is a model for anxiety as well. Hole board test, so there are different holes that are created on the base of the particular chamber, and the animals are acclimatized. So first they are given a training period, and then after a 10 days 5-day training period, there's a different camera on top over here. Suppose there's a camera fitted, and a digital camera records the exploratory activity or the influensive activity of the particular animal. Elevated plus maze, so this is a plus maze. So why is it called plus maze? Because it is having this kind of shape, plus shape. You can see plus shape. So this is a open area, open arm, and this is a closed arm. So the time that the animal spends in the open arm and the time that the animal spends in the uh, closed arm is very important, right? Moving ahead, we have light and dark test, that is again very widely used. So we have two different models. So white rats, if now this is very important concept that I've written here. It is very simple but very difficult for some people to know. If you're using a white rat, your background must be black, and if you're using black rats, your background must be white. Obviously, the color of the rat that you're using, you have to choose an opposite background. So because light dark test is based upon that contrast, right? So this is important test. So we have plexiglass, we have different grades of glass that are used. Then we have motor coordination test. So Hugo Basil, we have lot of different companies, like we have Shimadzu ke HPLC for estimation of lot of different metabolites and all. Hugo Basil ke we have lot of equipments, and there are Sigma Aldrich chemicals and all. So Biorad ke you have electrophoretic machines. So you should always know about the companies as well involved. Um, when you are doing research, which company is offering which equipment or which device at what cost. So this is a rotar rod, the animal is kept over here and the balancing activity is checked. If it is having a if it is having a skeletal muscle activity strong, so it will be strong firm grip. If the grip is weak, that means the activity is also weak. Tail suspension test, you also have cylindrical arm test, where you have checking of the exploratory activity. Then you have wire grip strength test, so the animal is suspended like this upon from the top, and the immobility is checked, so whether it is being immobile or is it moving. Then moving on, we have anxiety models. So as I mentioned before, anxiety usually deals with serotonin and GABA receptors. So a lot of receptor binding assays, serotonin binding assay, GABA binding assay, benzodiazepine binding assay. Besides this, we can check conflict models. We can check exploratory activity, social, behavioral, or predatory activity. Like there is odor induced anxiety as well. So if there is foul odor, there will be development of anxiety. If ultrasonic distress cell, voice, so there can be acoustic induced, open field, closed field, light dark, elevated maze, vocalization test, four plate test, Vogel's conflict model. Then this lick model, Marmoset model. These are all different models that are used. Anticonvulsant activity, so PTZ, strychnine, picrotoxin, these are all agents that are anticonvulsant. Yohimbine, as I previously mentioned to you. So elevated plus maze. You should always, whenever you're studying a particular model, screening model, you should know the purpose, क्यों कर रहे हैं, the source, the procedure, and the different parameters by which you are recording. Like plus maze, so you are checking the amount of time spent by the animal in the open arm and closed arm. Then the source, you should know the different parameters that affect the height of the maze, the light applied on the maze, and all those things are parameters. Why are you performing the test? The reason for performing the test. In vivo models, maybe have lot of different in vivo models like tail immersion test, radiant heat test, chemotherapy induced model. So there are a lot of chemotherapeutic agent like cisplatin is widely causing lot of neuropathic pain and lot of harm, oxyplatin, cisplatin, है ना? So then in the spinal cord injury, we have chronic constriction injury, where the dorsal root ganglion, you have check the MNCV, motor nerve conduction velocity, SNCV, uh, s- uh, MNCV with motor nerve conduction velocity, SNCV, right? Sensory nerve conduction velocity, dorsal root ganglion, chronic constriction injury. Then you have grid shock test, hot plate test, right? So plantar, then you have different tests called Hargreaves test, which is plantar test, one fray. So one fray are basically filaments. So you have fine filaments, blunt filaments. So you check the allodynian hyperalgesia using these particular techniques. Then you have Rendell-Seleto, Paul threshold, and Paul latency. Right, so there is a lot of Rendell-Seleto is a technique that is useful for this. है ना? Then we have Hargreaves may you keep there's a glass and then there's conduction of heat by the Fourier's law, and then the hot plate or IR source, the glass surface gets heated and the animal withdraws the paw. So the time of withdrawal, and there are different flinching effects, withdrawal, licking effects, all those things you check. And tail flick analgesiometer and all. Then there is cold allodynia technique. So in cold allodynia technique, you basically check the acetone. You take a syringe, you fill in the acetone, since acetone is a cold evaporative effect. So it quickly evaporates, leading a cold sensation. So it is a allodynia kind of chemical allodynia. है ना? So like Rendell-Seleto is a hyperalgesia technique whereby you apply the pressure. So one is pain causing and the allodynia is non-painful stimulus. So all these techniques, and there's Hafner's tail clip model as well. So this is an ultrasonic distress cell. You keep the rats in an ultrasonic distress and you either check the extent of vocalization. You increase or decrease the vocalization rate, and then there is distress measurement, right? Light dark model, as I previously met. Social interaction model. So you check the sniffing, grooming, rearing, all these activities, gnawing, है ना? Staircase model, as I mentioned here, there is a staircase you can see, right? Like this, there is a staircase. So the animal, you can check the anxiety activity using this model. Then there's toxicological model. So toxicological screening can be either teratogenicity, carcinogenicity, mutagenicity, genotoxicity. Genotoxicity, it can be germ cell toxicity, somatic cell toxicity, reproductive toxicity, it can be female, male. The duration can be acute, subacute, chronic. The dosing can be single dose, repeated dose, depending upon the OECD guidelines you are following. And procedure can be up and down or FDC, fixed dose procedure, like 423, 425, 420, depending upon the type of procedure you are attending, like oral dermal inhalation 401, 402, 403, for skin irritation 404, for eye irritation you have 405. So all these particular testing procedures you have to keep in mind. So what all things you can do? You can perform micronucleus test, then you can perform chromosomal aberration test, Ames test for carcinogenicity, then there is a mouse spot test, Drosophila linked test, and all these tests are being used. Sex linked assays are there, like organ motility, organ size, organ weight, and organ number that you find. Morphogenesis, organogenesis, all those things you check. Embryogenesis. Then we have organ anatomy. You check the anatomy, whether there is any change in the seminiferous tubules, uterus, fallopian tubes, hormonal production. So there are different assays as well, like there is Comet assay, there is tunnel assay. There are a lot of staining techniques as well, TTC, HNE, PSR, which is used for detection of collagen, PAS, periodic acid shift for mucin, HNE, TTC, DAPI staining for DNA damage. And there are different staining techniques, that acridine orange, Nissel staining, and Western blot. Then there are different expression techniques, RT-PCR, ELISA, all those things you check. So there are different categories, biochemistry mein, histology mein, staining mein. Histology is the similar one, like you perform the staining technique in histology, compound microscopy, SEM-TEM microscopy, red confocal microscopy. And then there is in histochemistry mein we have different assays and the ELISA, RT-PCR, and all expression studies. So that all you check. Then we have different staining techniques, also other assays like LDH, MTT assay for cell viability, cell proliferation, cell migration, cell survival assays. So these are all assays that are like NADPH dependent oxidoreductase and MTTs based upon formation of formazine, which is further then dissolved in DMSO, right? So there is formation of a product, insoluble product. So you check the prenatal development, postnatal development, and all. Then we have marble burying test. So presence of any unfamiliar objects, potential source of danger. Parameters are number of buried marbles. So you check the number of buried marbles and then you estimate the particular activity. Then we have stress induced hyperthermia. So there is this is a very important concept. So whenever you want to check the anti-pyretic activity or analgesic activity or activity against hyperthermia, so there can be stress induced hyperthermia, there can be heat induced hyperthermia, and a lot of different conditions can be used. This is a Vogel's Lick conflict model. So number of electric shocks is, it's like a punishment. The number of times it goes to that particular drinking water, it gets a shock. So suppose here there's a, this is a cage, here there's a bottle, the animal is coming, it comes and shock, so it goes back. So this is what is checked. Stressful stimulus, MCPP model. So MCPP is methyl chlorophenoxypropionic acid, which is a chemical that induces anxiety. So like there is a lot of Parkinson model, maybe we have MPTP, rotenone, 6-hydroxy 6-dopamine. These are all chemicals that then in Alzheimer we have beta secretase, gamma secretase, tau protein. Then there are different genes that you check upon: LRRK2, calpain, Parkin, and different channels like TRPV, transient receptor protein channels, TRPVC, TRP5, and all. है. Then we have a lot of activities like NLRP, 3-inflammasome activity, and all that you particularly check. So these all activities can be determined and estimated. So this is very important when we talk about these activities: LRRK, calpain, Parkin. So you can have a look at these activities and these genes that are involved in active. Like then we have tau protein, so amyloid plaques. So you induce the there are formation of fibrillary plaques, amyloid plaques, and they are induced via stereotaxy. Then we have Gellar conflicts paradigm. So it is used for conflict period testing, and an increase in the level of pressure indicates that it is an anti-anxiety, and a decrease in the level of pressure indicates that it is a anxiety agent. So when it is the decrease in the liver presses, anxiety agent; increase in the liver presses, anxiolytic agent. And finally, so for central analgesic activity, we have vanilloid receptor binding assays, VRP. Vanilloid receptor are widely involved in lot of different conditions. Then we have bioassays for pain, nociception. Bioassays techniques are also very widely used. Then we have radio receptor binding, chemoluminescence binding, fluorescence binding, chromogenic agent binding. Then we have dihydroxymorphine, naloxone binding, which is a morphine antagonist. So that's it from today's video. I hope it was informative for you and you would have learned a lot about screening models. So more videos of regarding pharmacology and toxicology I'll be uploading. So yes, have a good day, keep learning, and let me know in the comment section your doubts if you have any.